Hi, Alex from Stoic Conditioning. Today I'm being joined by Dr Angela Servis from the Eden Clinic, who has come down today to answer all of our questions to do with testosterone, hormone health, and testing and diagnosis that's really crucial for our community to know about. So Angela, thank you so much for coming down. It's really great to have you down in the facility. Talk to us about your background, your history, what have you been doing for the last 20 years?
I am trained as a GP. I joined up on a medical cadetship and trained in Plymouth. And Plymouth then became my base essentially. I was lucky enough to get posted to Hona, worked with the Royal Engineers for a bit, which was great fun. It was really, it was a really good experience. And, went on some pretty good exercises and travelled quite a lot internationally during my time. Managed to get a Herrick tour in as well, which was really interesting, certainly from a medical point of view. And then finished up back in the UK at 29 Commando as well, which is another great experience.
So that kind of like breadth of experience that you've got and kind of those deployments and stuff, it really gives you an idea of the cadence of these guys' lives, and it gives you a deeper understanding than maybe another medic that wouldn't have deployed on these tours and stuff like that. So you actually understand what it takes from people to go away and come back and change setting, change intentions, and all this kind of stuff. So it just informs like how you treat them, how you can treat these people going forward, right?
Yeah, absolutely. And I think, the impact that all these changes can have on family life and can have on relationships. And, even if it's not deploying operationally, even if it's just going away on exercises, the pressures that can put on can be quite isolating for every party.
Yeah.
And if you add to that, a physiological lack of confidence because of hormonal disruption, we're very accepting and understanding of women's hormonal disruptions. We talk about women's HRT, and there have been some wonderful things done and driven by the media, but actually we're not in the same space with men's hormonal health by any means. And I think, it can almost become, sometimes when you see social media posts where people are trying to draw attention to men's hormonal health, the comments section becomes a bit of a, it can't be as bad as women's HRT, issues surrounding that and everything. And they're different questions.
Yeah. Two things can exist in truth at the same time, right?
Not a competition, guys. I think that making sure that there's an element of support for each other and facilitating that understanding, and for getting men's hormonal health into the primary public sphere, and not being a niche area of medicine, or something that happens in America that you sort of read up on and try and get some information off that way. It should be something that we're discussing in primary care and making sure that men are as well informed as women are about their own hormonal health.
That's that kind of proactive healthcare that we really ideally should be leaning into as as a community, but then as a nation as well. I mean, it's just gonna, as a species even, So talk to me a little bit about to start with, the background and motivation behind the Eden Clinic. So you were an ex-Army GP, and when you left the military, you set up the Eden Clinic. So what inspired you to set that up?
I suppose actually it all came from a bit of a knowledge gap. So I think a lot of clinicians, when they start following an area of interest into medicine, it comes from an area of uncertainty, and that was definitely something that happened for me. There was an individual patient who I had met on my first posting, and he had been a really gregarious, very energetic, bit of an alpha. He had a beautiful wife and family. He was going places in his career. He was really into his rugby, and I saw his name on my clinic list much later on in my career. And I was really excited. He was really good fun, and I, just wanted to catch up with him. And as you do, I looked through his notes just before he came in, and there was lots of different things going on in the background. He'd been on lots of different antidepressants. He was pre-diabetic. He had lots of sort of social issues going on in the background as well. And the guy that walked in through my door was, as he described himself, a shadow of a man. And he'd been tried on so many different medications, all of which he had said had made everything worse, that on a bit of a whim, I did a full set of blood tests, including a testosterone, and it came back low. And then I realised I needed to figure out what to do with that low number. And that was really what developed my interest in testosterone. After that, I then joined the British Society for Sexual Medicine and started on my educational journey, and have since gone on to complete a postgrad diploma in endocrinology. And it really became a passion because it became very clear to me that it was a really underserved area of medicine, and also that men don't often come forward for help medically. And when they do come forward, you need to get it right, because they don't necessarily come back again if they don't get the answers that they want. Yeah,
it's that kind of like proactive side of medicine that, you know, really if people lean into it, it can curtail quite a few issues in the future. But trying to get people in and be like, you know, get this regularly done, because it just tells you a lot about what's going on. So how would you say that your background in the military and your military careers really led you to specialize and change things within like the male population in the military, specifically in that kind of demographic, with people who are leading like incredibly demanding lifestyles as well?
Yeah, absolutely. It's a good question, actually. I think probably the interaction that you have with patients in a military setting as a GP, you're quite blessed in that you can get to know patients quite well. You will often remain with them, and you'll have a bit more consistency of seeing them along their journey. And actually, for example, with this chap, you know, I saw him years after I'd first met him and his family. And that's quite unique, but also you're used to seeing people with real fluctuating levels of pressure, of stress. You know, they'll have geographical changes going on, they'll have courses, deployments, and all sorts of different pressures as well. So it's really important to be able to get people to open up to you about how those pressures are impacting them, and also, I suppose, get really good insight into how they might be being impacted on geographical changes and things like that as well. But listen. So ask the question and then wait and then listen and get that information from them, and hopefully get a bit of trust going. So it might be that they come into you about a couple of other different things before they actually talk to you about the thing that's really bugging them.
Understand that that's kind of hidden behind that. The first initial question's almost like hidden behind the facade is the actual root of it all. So
yeah, absolutely. And I think sort of normalizing talk about mental health, because often, you know, testosterone deficiency can certainly come about as a mental health problem. It can be sort of low mood, lack of motivation, you know, brain fog, all these really non-specific symptoms. And actually creating a safe space to be able to talk about these things, you know, in the consultation room, so that people feel more comfortable about coming forward. And particularly about making it acceptable for people to come to you with sexual dysfunction problems as well, which is another quite a prominent feature for some people for testosterone deficiency as well. And encouraging people to talk about those, you know, should it be impacting them as well.
Awesome. So moving on to testosterone and hormonal health, what are the key symptoms that you see or characteristics that you see in someone who would present with low testosterone?
It's a good question. So for different people it can be different things, and I think one of the reasons that it often goes undiagnosed or misdiagnosed is that there's so much overlap with other conditions. So really commonly it can be low mood, low energy, sort of apathy, lack of get up and go, difficulty decision making. Yes, there are, you know, there can be sex drive issues as well, so low libido, and erectile dysfunction. And I think some people, often when you're taking a history, you'll ask about erectile dysfunction and say, oh no, everything's fine. And then you say, so are you having spontaneous erections throughout the night and in the mornings and things? Oh no, not had those for years. And actually it's sort of defining that as well. people don't even necessarily realize they're symptomatic with until they get treatment. So they they might go on to have treatment based on low numbers and some other symptoms, and actually they'll be like, oh, I hadn't realized how much I've been procrastinating. I've been really struggling to get onto decision points in meetings, and actually fixing and finding solution for the testosterone deficiency can draw attention historically to where there were problems. But
I think for a lot of people there, that decline happens so slowly sometimes and so insidiously that you don't notice it. And the new norm is just how you feel every day until, you look back 10 years and you're like, oh, I used to be like that and now I'm like this. And you don't really feel that decline until you get there and you check your numbers. That's why it's so important to have your numbers checked all along the way, right? And, it just gives you that peace of mind from a historical point of view of like, oh, I'm steady, or things are going down, things are coming up. Like, I think that's super important, right?
Yeah, absolutely. And I think, people don't realize so much that testosterone levels will fluctuate during the day. So for example, they'll be higher first thing in the morning. Often people will talk about like, 3-4 o'clock in the afternoon, I'm absolutely knackered, or after I've had a big meal, you find it really hard not to drift off. And those are often things that can come alongside it. And sometimes people will be diagnosed with anemia or type 2 diabetes and things, and actually alongside that they'll have a testosterone deficiency as well.
Yeah, so I was going to ask if there's are there other symptoms or other conditions that might present as low testosterone in terms of those symptoms, but their testosterone levels and hormonal profile tests fine, it's just something else underlying?
Yeah, for sure. And I think sometimes they go hand in hand. And so for example, depression, and unfortunately a lot of the medications used to treat depression, a lot of the antidepressants will worsen the symptoms of testosterone deficiency. So the libido symptoms are worsened, the sort of that feeling of anhedonia, the sort of feeling flat and just joyless, I suppose, in some ways, can actually be worsened by some types of medications that you'd use to treat depression. Vitamin D deficiency as well. Things that are causing sleep disruption as well is another one. So things like sleep apnea. It can alter some of the hormones that signal testosterone production as well, and that can sort of worsen symptoms there as well and create that ongoing fatigue. And also medications, so alcohol, chronic alcohol use, opiates can actually cause a testosterone deficiency as well. So there's lots of different things, and I think that in some ways doesn't really help the testosterone deficiency picture and the diagnostic uncertainty of testosterone deficiency. There can be lots of different things going on at the same time. I think, some papers have found that 1 in 4 people with type 2 diabetes will have testosterone deficiency as well. And if you get it at that pre-diabetic stage, you can actually often get back from there and bring yourself back into better glycemic control moving forwards as well.
It's always far easier as well. If your testosterone levels are then starting to come back up alongside you, reducing caloric intake, reducing carbohydrate intake, moving more, like fidgeting more throughout the day, all those things that really help us get back from that pre-diabetic phase into a normal blood sugar profile. It's just made so much easier when your testosterone is actually in the right parameters, right?
And I think it's really difficult as well, because I often hear that patients have been told, well, you've got testosterone deficiency, your numbers are low, but if you lose weight and come back, then I'm sure your levels will be fine again. But actually getting someone who's truly hypogonadal, or who truly has testosterone deficiency to lose weight, it's really challenging.
It's really challenging. It takes a lot. I mean, it's not just a case of like calories in, calories out. It's a whole ecosystem of like changing that person's entire lifestyle. My background of body composition work, when you get somebody through the door who's like, I need to lose weight, or I want to do this for health reasons, or I want to do this because I want to step on stage, and you look at their blood hormone profile and their testosterone's in the pan, it's like, that's going to be a very long journey. Like, let's put our expectations first. This is going to be, this isn't a case of weeks, this is months, if not years, of getting you back into that position. But that's just accelerated when their hormones start to come back up. And if you can do that proactively from a pharmaceutical background, it just makes everything so much quicker and easier for people.
And I think a lot of the things that you've just drawn on there is, yeah, you can talk about a long and arduous journey to being back to, in having a better body composition or whatever. But actually, when you haven't got much testosterone floating around, that element of mindset that you need for a long, hard grizz to get back to where you want to be, or maybe even you haven't been there physically before, you want to get into that space, that's really tough. It's a really big ask, and for some people it isn't necessarily possible.
And mindset is absolutely everything to do, when it comes to body composition changes. Mindset is one of the primary things that I focus on as a coach, and we focus on as a company. You've got to have that right. Once you set that right and you set your expectations right, everything else is just a process. It's just a system which you can follow, and it's made easier by, or accelerated by, good hormonal profiles, things like that. But it is just a system. But then when you think about injuries as well, and the mechanisms of repairing an injury, again, if you're deficient in testosterone, low in testosterone, something that you could heal from in 2 to 3 weeks might take months. And when you have some people who are in the careers of our community who, their physical output is everything, it's their job. An injury that takes months to repair from because they've got low testosterone is a bit of a career ender, if not just a game changer work-wise. So.
And I think even in the, from, as you're saying, from the point of building muscle, the recovery period, that's one other thing actually I didn't mention earlier. The recovery period, someone goes to the gym and they'll be like, right, today's the beginning of the rest of my life and everything, and they'll get into the gym. And they'll put themselves in the locker for, over a week. And actually, there's only so many times you're going to do that without seeing any progression, without seeing any increases in strength, before you say it starts feeling a bit hopeless. And like you say, that goes back to that mindset. So it's really, really challenging. And I think it's too simplistic to say go away and lose weight and come back. It's not helpful, and it certainly needs to be followed up with quite robust, like you say, diet and lifestyle advice, supportiveness.
Set people up for success rather than just kind of giving them like a little tidbit and sending them away. Just like fully set them up to get the result.
Yeah, absolutely.
So let's get into the actual testing and diagnosis side of things. So talk us through what tests you actually perform when someone comes into the Eden Clinic.
Yeah, okay. So usually if people are coming in, there'll be one of two camps. One is that they feel they're symptomatic and they're concerned they've got low testosterone, or they're just interested. They want to know what's going on. They might be looking at optimisation, or their mate's done it and they want to give it a crack as well. There's not much variation in those two. If we're looking at testosterone, we will always look at total testosterone and then free testosterone. Basically, testosterone will circulate in the body attached to a protein called SHBG, or serum hormone binding globulin. And that essentially puts it in a wrapper so that it doesn't all get broken down straight away or used straight away. And so you might have a really high total testosterone, but actually a relatively low free or available testosterone. And that could have an impact on you from a symptom point of view. So if your SHBG is sky high, your free testosterone could be quite low, meaning that you could have quite a lot of symptoms. And so that's quite an important element to think about. Now, the types of testosterone deficiency, essentially you'd be thinking about where the deficiency is coming from. So we've got hormones in the brain that go down and tell the testes to kick out and create testosterone and sperm. And if the hormones in the brain aren't signaling down to the testes, then that's one element of them. So we'd be looking at luteinizing hormone and follicle stimulating hormone to assess those. And that's a really important part of that process. We'd also be looking at prolactin, which is another hormone that's coming down from the brain, and we'd look at the thyroid hormones as well, including the thyroid precursor hormone, TSH, or thyroid stimulating hormone. And looking at those all together is obviously really important. But we also, as we've mentioned, testosterone deficiency can simulate lots of other things. So we want to be looking in at your vitamin D levels as well. We want to look at your liver and kidney and see what's going on there. We would be looking at your insulin sensitivity as well. So we'd be looking at your glycosylated hemoglobin, so your HbA1c. And that looks back at your blood sugar control essentially over the last 90 days. So sometimes people will come in and they'll just say, I just want to know my testosterone. And that will give you an answer, a very specific answer. But actually, if you're wanting to know anything else about the rest of your health, even if it's normal, there's still more questions to be asked.
In the realms of the body, nothing works in isolation, right? You know, you need that full comprehensive picture, because if you don't, you're just shooting in the dark, right? You just, oh, your T levels are high or your T levels are low. Okay, why? You know, that's the question it always comes back to. It's like, why are they high? Why are they low? Oh, your SHBG is really high. Okay, cool. That accounts for that. Why is SHBG really high? And you keep tracing that back, right?
Keep going back, yeah, absolutely. And sometimes you won't necessarily always get the answers. You know, I mean, we know that men have a reducing testosterone levels sort of post the age of 30. It's sort of 1 to 2% a year that it starts dropping down.
Awesome.
Yeah, you can look forward to. But actually, there'll be other things that are influencing that as well. You know, I mean, you only need to Google endocrine disrupting compounds or endocrine disrupting chemicals and get really depressed yourself on a Sunday afternoon.
Look at the EWG website and you're just like, oh wow, terrible.
Yeah, absolutely. So there are lots of different things that are impacting you. Also, you know, we've mentioned sleep, stress. There are lots of different things that are outside your control and that you might not necessarily have been particularly aware of that were going to impact you so profoundly on a hormonal level. So those are sort of other elements to think of. But also, you need to think about when you're timing your blood test for. If you're looking to see what a meaningful testosterone level, then I would recommend doing it sort of in the morning, between sort of 7 or 11 in the morning-ish. Wouldn't bother doing it after a night shift unless you're particularly wanting to assess the impact of a night shift on you and your sleep, on your testosterone.
Which is always a terrifying result.
It's horrible, and you know, but it might be something that's interesting for shift workers. People are doing that regularly. Thinking about, you know, what phase you're in your training as well. If you're an endurance athlete, doing testosterone levels at different times in your training will give you very different levels. If you've been recently ill or, you know, had a significant illness recently, then that's also something to be bearing in mind and thinking about medications and things like that as well. So,
and I think for our community in particular, you know, you mentioned stress, sleep, you know, work lifestyle, exposure to toxins that you're not really, you know of. And it's just like, wow, we're hitting all of those with our community. And it's not to doomsay or, you know, scaremonger or anything. It's just like, be proactive with your health. You know, don't wait until you're in your 40s, 50s, 60s and then be like, hey, I wish I would have done this 30 years ago. You know, get those markers down in place, put a line in the sand where you can look back on and be like, that's what my markers were like, and my hormonal profile and my blood profile was like when I felt great, you know, and then 6 months later you could be like, hey, I feel like, you know, 2 pounds of shit in a 1 pound bag. Like, why is that? You know, you look back on your blood and you can have that kind of comparison, and that will inform you a lot more, rather than just, you know, a whole comprehensive blood panel is great, but it is a snapshot of who you are at that person, at that time, you know, whereas if you are doing it every 6 months or every year at least, you know, then it gives you an idea of how things are trending, right?
Yeah, and I think that's actually really important. And, you know, I do get guys coming in and they'll have sort of a lower end of the spectrum thing, and I say, well, don't make a decision based on right now. You know, have another look in at 3 months time and 6 months time, whatever. And I think that's really important, particularly because of sometimes I can imagine some of your guys will have quite a transient stressors going on, depending on whereabouts they are and what they're up to, and certainly from a training point of view as well. So it's worth thinking about that. It's worth documenting where you were in what phase of what blood test, and like you say, knowing what good looked like on paper, and when you were good, and you know, and reassessing later on down the line. I think that's really important, because actually you could check a testosterone level three times at 3 different times in the day, and it would be very different, and it would paint a very different picture. but it's being able to apply that to your life and your training cycle, or wherever you are.
Within the context of what your life's been like
Yeah.
for the last, as you say, 90 days, that kind of thing.
Yeah, I mean, even from the point of view of, we know men's testosterone levels drop in the first year if they're living with their baby. We know that they drop off, and it's difficult to fully understand why. Part of it might be sleep.
Yeah. Oh yeah.
But it's definitely, it's definitely something worth being aware of, and just keeping a watchful eye on it. It doesn't mean jump on TRT when you've got a 1-month-old, but but it does mean that it's worth just being mindful of it and sort of seeing where you recover back to as well.
Yeah, awesome. So to what extent can lifestyle really affect hormones? So things like sleep, stress, diet, nutrition, hydration, meditation, and training. How can that really affect a hormonal profile?
Oh, I mean, massively. And I think you can compensate for it to a degree, but I mean, if you think about what happens when you switch off all those buttons and you mess up your sleep and you go through periods where you're drinking more than you should be, and you're not training so well and your body composition starts to suffer, that's having a metabolic implication. And people will probably relate to the fact that actually they could tolerate a bit more of that flexibility at younger ages, and then as they age more, actually that flexibility, they don't bounce back as well and things. So yeah, I think it does have an impact, and I think the majority of your people leaning into Stoic are going to be about optimizing these things. I often find it really interesting when I do reviews for guys who have come in and they've been really symptomatic when they first get in, and then we get to doing a bit of a review and things have been really improving, and it might be a couple of years in or whatever, and we'll be talking about lifestyle stuff. Particularly alcohol's a really big one actually, and we'll be going back to that, like, oh yeah, no, have a few drinks on the weekend, and we actually like get down into the nitty-gritty of the units and stuff, and they might not necessarily be so keen to lean into changing that, but they'll be quite happy to go about changing testosterone doses and things. And this is where it starts. It's interesting because actually when you draw attention to that and you're like, oh yeah, okay, fine. And actually we are talking about testosterone is not going to make up for other lifestyle choices that aren't in keeping with your goals. And I think that's one of the really, really key bits. I always say TRT for somebody who's testosterone deficient is like me handing you a toolkit. And if you plonk that toolkit in the corner over there and it just gets a bit dusty and don't really do much, then that's exactly what it's going to do. But actually, if you optimize everything else around it and you get it out the toolkit and you get going and you get training, you optimize your mindset, you optimize sleep, you go through all your sleep hygiene, all the day-to-day grind, the fun and the exciting stuff, then you'll get loads out of it. But not always, but a lot of the time when I think people aren't necessarily coming back with the results I'd anticipated for them, often it's because the other bits and pieces aren't quite optimized alongside it yet. I think mindset is possibly one of the toughest ones. Because as you drew on earlier, like that insidious nature, if your levels are just dropping each time, you almost learn a behavior pattern alongside it, and changing that is hard.
Well, it comes back to habits and systems. It's very easy to slip into bad habits, and then that habit gets ingrained, and then that habit is all and you just wake up, and if you wake up in the morning and you don't jump out of bed because your T levels are low, and then all of a sudden it's like you've done that for weeks and weeks and weeks. You're not getting out of bed with a spring in your step. You go downstairs and you're like, I need 4 coffees to even wake up, and then you get sun on your face, but by then it's like approaching 9 a.m. that kind of thing, and then you're going into work and you might work inside and you're not getting sun on your face and you're not training, or you're like, oh, I'm going to put my training at the end of the day. Which invariably is, something's going to knock into that, and unless you're very disciplined, which, if your habits aren't great and your systems that are in place aren't great to start with, then it's just that downward spiral, right? You know, and as you say, you can chuck testosterone in there at any given point, but if that kind of downward spiral and if that habit loop, feedback loop isn't changed or isn't even slightly improved on a positive upscale, then you know there's almost no point in doing the testosterone, you know, the TRT.
Yeah, absolutely. I think what it does do is it gives you the space and the energy to initiate some of those decision-making processes until you can make them automated. And you know, I mean, that's the beginning of good habits, isn't it? You you make your mindful choices until they just become part of the routine, and then you make some other cool mindful choices, and you just keep 1%ing it.
That's it.
So
awesome.
yeah.
So for men looking to get their blood work done, what's your kind of ideal situation that you would say in terms of like timeline for getting them done, when to get them done, but also like how frequently?
Yeah, I mean, it sort of, I don't want to answer a question with a question, but it depends a little bit on what they're up to. You know, it can be useful for people to look at things when their tempo is high, when their operational tempo is high and they've got lots of training going on, potentially when they are under stress, to see where things are, and then see what things go, how things change when they go into a bit more of a rest phase. And again, you're looking at the trajectory, you're looking at the overall, you know, how things move forward, and the things that can change it. I think looking at testosterone in isolation as a general rule, unless you started noticing a significant change on the down, isn't so helpful. I think you need to look at it in conjunction with other biomarkers and probably do some more holistic testing, sort of looking a little bit more broadly. But I think it's quite reasonable for sort of aiming to be looking at sort of 6 to 12 monthly. Particularly for your population.
Yeah, so getting something done regularly every year or half year. But then if you're up tempo in terms of your work cadence, or you're just interested to see how your body's reacting to sleep deprivation, stressful work environments, things like that, you know, you can also drop in another one throughout the year. Yeah,
and just making sure that you do actually ping down a little note on what's going on in life when these things happen, because I regularly get a barrage of blood tests with completely varying results, and it makes it quite difficult to interpret. But actually knowing that you just come back in, or you know, there's been, just come off some horrible endurance race or whatever, then it's useful to know those numbers and how you're responding to them. But getting back to your baseline, I think is making sure that you are getting back to your baseline. Or thereabouts is really important.
And in terms of working with you in particular and your background, your expertise and the lens that you look at everything through, you know, there's a big difference between optimizing and looking at getting your testosterone into a decent level for that person in particular, right? That individual, as opposed to just getting a snapshot of your bloods. You know, it might not be the comprehensive stuff that we've spoken about, just a snapshot, and then putting it against, say, for example, the NHS guidelines for like what these values should be. You know, because I get my bloods done regularly, and most of the time my testosterone is off the scale when it comes to the kind of like the general advised levels. But at the same time, when you look at it with all the other markers and stuff like that, it's actually just a mid-range. So, you know, talk a little bit about those ranges that are put in place.
And I think this is a thing that I find really sad, because guys come to the clinic with levels that are really low, but because they don't get turned red on their local guidelines, their normal range in their laboratory might be particularly low. So I encourage people to go to the British Society for Sexual Medicine website, and they've actually got a really good rundown on the sort of the normal ranges for total and free testosterone. And I think that can be quite helpful, because actually it's a bit of a postcode lottery. You could be in one town and actually the normal range be, I don't know, 8 nanomoles per litre or whatever, and then somewhere else it could be 15, and that has a massive difference. And like I said earlier, you get a guy coming in to see you and saying, I've got these symptoms, I think I've got testosterone deficiency. and the GP says, no, it's fine, your level's 9, and that's it, they go.
Yep.
And that's them done. They've been to their doctor's appointment for their 10 years, and they might not come back. And I think that's a real opportunity missed for him. And
emotionally and psychologically, that sets that person up for failure as well, because, you know, they're going in, they're being like, I don't feel great.
Yeah.
Can we look at these values? And it's just like, hey, the values are fine, go away. And it's like, doesn't answer any question. And then they, you know, you get into that mind spiral of like, well, maybe it's this, maybe it's something else. Maybe I've been looking up, you know, barking up the wrong tree. And all along they just weren't helped across the finish line, you know, with getting through the door and getting the tests and stuff.
And I think that's so important as well. Like, men don't have the same contact points with healthcare professionals as women. So women very much, you know, go through different periods in their life where, you know, they'll be going for period related stuff, for contraception related stuff, for baby stuff, for breast checks and things like that. And actually men have very few touch points. So if they come in to see a doctor and they're asking for help in a particular thing, it will be quite easy to be dismissive of that, and they might not come back to talk about that again. And for the profound way that testosterone deficiency can impact mental health, we owe it to them to get that right, and to make sure that we definitely offer them the support and diagnostic consistency as well.
So we're going to go into a little bit of like treatment and ethics side of things. So what's your general philosophy, opinion on TRT? When should it be applied? Should it be applied proactively, you know, getting ahead of things? Or is it like someone comes in, they test in the pan, you know, get them on it straight away? Obviously, you've spoken a little bit about looking at it from a holistic point of view, not just looking at the bloods, looking at that person, their lifestyle, what their job is, you know, everything building out from there, rather than just like, this blood marker says this, therefore this.
Yeah, I mean, it's really difficult, isn't it? And you don't really regularly see interviews about women's HRT being offered based on whether or not they've maximised their weight management, for example, or their alcohol consumption, or, you know, other dietary lifestyle type things. And yeah, we know that testosterone levels can be significantly impacted by sleep disruption. Do you ask night shift workers to switch to day shift jobs? I don't think that that's something that we can address all over. So I think we know that testosterone deficiency causes anemia, increases risk of cardiovascular disease, increases risk of diabetes, it increases your likelihood of developing depression. You know, it's going to create difficulty with sexual relationships. It will probably frequently reduce your output at work. There's a lot to be optimized. We can improve the quality of people's lives. You know, I regularly have guys say, my marriage is back on track, I've just been promoted at work, I feel fantastic again, I've got my confidence back, my friendships are back, I'm leaving the house again. That's really important.
Yeah, there's a lot to be said.
Keep that, you keep it safe. But actually, yes, people have to have a commitment to their health. And that's why it has to be a holistic treatment. You have to have the conversations about what's your sleep hygiene like, you know, are you doing your mindset stuff? Are you exercising? Are you thinking about your diet? You know, what are you doing from a medication point of view? Yeah, you've got to do all of that stuff. But at the same time, you know, it's making sure that you're offering these people what can be.
I think, you know, like that a lot of things are going to improve with that. You know, this person coming in, low testosterone, their lifestyle's maybe a little bit out of check. You know, it's your duty of care, I guess, as a doctor to be like, we need to get these things in line, but let's supplement it with, you know, getting this person on testosterone, bringing the levels up, you know, gradually monitoring that, but also like, you know, it's just that knock-on effect, right? It's cause and effect all the time.
And I think also the other thing is it can be really overwhelming if you've got someone coming in feeling absolutely cream crackered, completely knackered, no motivation, so isolated. And you're like, right, okay guys, I just need you to like address all of these bits of your life, if you can just make them better, and then we'll think about giving some medication for the next bit. It's really, really, really
Which
big
for someone who's like low testosterone, you talk to them like that and they're just going to be like, hey, I'm just failing at life, I guess.
Yeah,
so
totally overwhelmed. Exactly, and total overwhelm. And I think you know, sometimes even when they come back for their first review, they're kind of nervous and they're like, well, I've done this, I'm feeling this is a bit better, but I saw this guy on a forum who 2 weeks in, like, and his life was better. And you know, it can take months or years even to be fully getting back to where you were previously, because it's taken years to get there.
And it's a perfect segue actually into kind of the final question that I wanted to go through, which was like, how much has social media influenced men's health and TRT? And also, you know, not just for the positive in terms of getting the message out there, but the amount of misinformation. I mean, we combat misinformation when it comes to diet, nutrition, mindset. I mean, everything that we do under the umbrella of Stoic conditioning is akin to, or you know, falls prey to a lot of misinformation that just gets flippantly thrown around on the internet. So I'm guessing, or I know, that TRT and men's health is falls prey to that quite a lot. So
absolutely, but you know what? In some ways, it is just great to hear the conversation being had. And I think
all conversation is good conversation.
In some ways, I want to proceed out with something safe somewhere. But no, I think actually, yeah, it is great that people are talking about it more. I think, you know, I'm always really happy when I get guys being brought in by their boss or whatever, and it's like, I don't know, bosses saying, everybody come in, or we'll get a health screening test on the business or whatever. I think that's fantastic. I think it's really good. I think it's great when you get guys who've had a positive reaction to their treatment and they go and they talk about it. And they're not saying, hey, get on TRT, it's great. They're saying, hey, get yourself checked out. Or they're noticing the quiet guy in the office because they were that quiet guy. And actually, social media has done a lot, I think, for TRT. Yeah, there's some crazy stuff out there. But you know, this crazy stuff is what people comment on, and it draws attention.
That's it.
So yeah, it's like any crazy stuff on social media. There's good stuff to be taken from it, but I think the worrying one for me is when guys start comparing their journeys to somebody else's. And actually, a lot of people don't necessarily feel like having that conversation about their, you know, sexual function being restored on Instagram or whatever, or some do, I don't know, but it's got its pros and cons. But I think for now, where TRT we just need to increase awareness of it. It's a good thing.
Needs to be dragged into the limelight a bit more.
Fantastic.
Sure. Awesome. Thank you so much for coming down again, Angela. Guys, if you have any questions for Angela, or if you wanted to check out the Eden Clinic, where's best to contact you?
So you can either check out our website at edenclinic.co.uk, or you can drop us an email to support@edenclinic.co.uk.
Awesome. And if you have any questions for us or for Angela, or based on everything on this in this video, pop it in the comments section below and we'll always get back to you. From everyone behind the team at Stoic Conditioning, wherever you are in the world, stay safe, and we'll catch you on the next one.